What is the honest truth? What does it take to heal strong and come back after serious surgery, especially later in life? I'm Janet, longevity coach, competitive bodybuilder in my late 60s, and a woman who strived to live the message of aging strong even after major surgery. I didn't bounce back overnight, but I learned how to partner with my body instead of fighting it. I will walk you through 3 powerful shifts that helped me recover, rebuild, retrust my body. You can too. So whether or not you're facing a knee replacement, shoulder repair, maybe major abdominal surgery or a lengthy illness, and you're finally on the road to recovery and you're wondering, am I strong enough to survive this setback? Just before turning 70, I did something most people dread. I had knee replacement surgery. I haven't talked about this before here on YouTube. I'm going to today because there are such important, broad applications to what I'm going to tell you about life, setbacks, resilience, and starting again. Honestly, most of the fear I think people experience when deciding about whether or not to have surgery is based on what we hear and see around us. Our brains are wired to hook on to the negative or the spiral of what ifs that goes in a negative direction. I heard it all. You're too old to bounce back. You'll be sorry. My cousin had it done and they've never been the same. That'll be the end of your active athletic life. Even one of my physical therapists said that to me. Not true. I didn't just recover. I came back stronger than I was before. Now, to be fair, this was not my first knee replacement. So I have a legit comparison from first to second. I had my first one back in 2012 after spending 40 years on that knee with no cartilage, no ACL attached after a really bad injury, back when technology wasn't good enough to repair it. Way back in the 1900s, the dark ages. At age 56, I finally decided I needed to get it replaced because it was really hampering my life. But despite being told I would never compete again, I recovered, I trained, and I went back and won trophies on stage for the first time. So never say never. That experience gave me a sense of trust in my own body and this belief that I could do hard things and to not take someone else's word for it, find out for myself. I kind of knew all those things before, but I had never really gone through this with something this serious. Now, my other knee, it had been decades. Overcompensating, load-bearing joints can only be superheroes for a long time. And my right knee was a superhero, ready to retire. I threw everything at it leading up to the surgery. PRP, stem cell surgery, red light therapy, corrective physical therapy. But the damage was too far gone. I knew if I let this slide, I'd be heading into my 70s weaker and more limited than I was willing to accept. So I made the decision. But what I didn't realize was how different the second surgery would be 12 years older, 12 years later, with a new body, new recovery, and a new recovery timeline. And even with my past success, this comeback would test me in ways I wasn't expecting. And I want to be transparent about that. The surgery itself went really well. I actually used the same surgeon for both surgeries. He works with Major League Baseball and football players whose careers, by the way, depend on him being really good at what he does. I was his first female bodybuilder, though. His work was beautiful, very precise, like an artist. I mean, he's completed thousands of reps on this procedure, mastered his craft, putting athletes back together to be top performers. He knew what I wanted in an outcome. I think it helps in the process too, to be comfortable and very trusting in your healer. There is a mindset going into the procedure where maybe you're a little nervous, but not fearful. And just like last time, I started physical therapy the very next week. But let me be clear, it hurts. This isn't the pain of damage, it's the pain of healing. There's a difference. And you have to move through it rather than around it. So with pain of injury, we try to get around it and get past it. But the pain of healing, you actually have to transition through for it to really be effective. I'm a firm believer in that. I'll get more into that. I have talked to so many people who have had the procedure or who have a family member, so they had to help them, with their bandages or their crutches or driving them to their appointments and such. And the biggest divide for joint surgery that I have heard between people are people who go to physical therapy within the optimal window right after surgery they begin, and the people who put it off or go to a couple sessions and quit early because it hurts. But the people who started right away and went through the whole series until they completed all of the benchmarks that get you to the point where you are flexible enough and ambulatory and able to function in life, where the surgery, the aftermath no longer is a hindrance to you being able to experience life. So much better. That optimal window is right after surgery in the weeks following. And if you wait, you will still heal, but maybe not all the way, and it'll take longer. So the longer you put it off, the longer it's going to take. Go right away. Go as soon as possible. It's so important for your healing journey because it affects the rest of your life. You don't have to be a major football star to understand the wisdom of this. It's just that when you're actually experiencing it, it's hard because the recovery is not just physical. You must know this. There is a mental healing that goes along with it. The mental game, though, is the most powerful part of it. Your body is wired to thrive. It wants to get better. But what goes on up here can be all kinds of problems. I learned this the first time I went through this 12 years ago. I stayed in constant conversation with myself, speaking the way I would speak to someone I loved. And it sounded like encouragement. It was gentle, no doom and gloom. When people tried to tell me horror stories, I'd listen compassionately, but it was almost like, shields up, Mr. Sulu. Don't absorb that energy. And every week, because I was going to physical therapy and working, I walked a little stronger. I went from a shuffle to a stride. My knee kept flexing just a little bit farther every week. We measured it in inches, millimeters. So it was very motivating. I pushed to resume real life. I was back in the gym training clients within 2 weeks of the surgery. Not because I had to, but because I wanted to reconnect my body with my purpose. That's powerful. I couldn't drive right away, so, it's like whatever it takes, get her done. I Ubered to the gym until I was able to drive. I carried a lightweight folding chair that I carried around with me and sat when I felt fatigued and achy. Sat next to my client while they were doing their reps. So I was right there present and then just moved my chair to the next spot. I got all kinds of teasing. My fellow trainers would say, oh, here comes Janet with her director's chair. Where's your megaphone? Where's your clapboard? But it was really helpful to just get right back into it right away. It left me less time to ruminate about how my healing was going, why this was still hurting. There was no time to feel sorry for myself. But here's what caught me off guard. This time, the fatigue hit me like a tsunami. After a few hours of training clients, what would normally not tire me out at all, I'd come home and crash. I wasn't just tired. I was tree falling in the forest, spent, exhausted, done. I would nap for 2 hours straight, and then I'd wake up just in time for my physical therapy session. And I'd do it all again the next day. I resumed, but really, healing was my full-time job. It wasn't like that the first time. The first time, the fatigue, the loss of appetite didn't happen. But here, I was having this unwanted weight loss, muscle loss. I was so tired that I wasn't moving as much, and I was too tired to lift weights. I did the physical therapy, but I did not leg press or do any of the other things. I was just exhausted. This was all new. And I had to sit with that discomfort without spiraling into fear, without panicking that I was never going to recover. Some days it felt like that, but I had to believe beyond what I was experiencing. I had to trust that this too was part of the process, that my energy, my strength, my fire would come back as long as I didn't give up on myself. And as I moved through recovery, I realized there were 3 mind shifts that made all the difference, not just in how I healed, but in who I became on the other side. So I'm going to share those 3 with you now. The first one is the mind and the body need each other. Healing is not just physical. I know intuitively you know this, but I want you to hear it in a different way right now. Your way that you talk to yourself, your thoughts, your internal dialogue, your words, your tone, it matters. Your body is doing the best it can with what you give it. If you're under eating a little bit, if you're sleeping all the time, it's going to kind of flex with that and do what it does. But this up here is the driver. Your body is doing the best it can. This book that I read during this time, I reread it actually, The Biology of Belief by Dr. Bruce Lipton, talks about how the very cells in your body change based on what you are thinking and how your emotions are processing through your body. It's an eye-opener. This is truth right here. It's really, it sounds airy-fairy, but it's biological. They've been able to measure it by wiring people up and watching their cells under microscopes and seeing how the body's physiology is very chemical at the basis, at the cell level. If your mind is fighting or judging your body, the recovery gets harder. When there's alignment, when you show yourself compassion and patience and encouragement, something incredible happens. You don't just heal, you transform. You become something incredibly resilient. Shift number 2, protect your environment. And that means in here and out there. The out there is just as challenging as the one in here. So what I mean by that is be very selective about the people and the content that you let in while you are healing. I mean, yeah, you should do it all the time, but be especially vigilant during the time that you are healing because your body is just going full forces for healing and it needs all the support and protection it can get. So doom-filled stories, negativity, fear, it's everywhere. You will hear stories of somebody's, individual experience that gets then projected on you that this is probably what's going to happen to you. I don't know what people think they're doing, but it's everywhere. I think maybe it isn't always that way, but when you are in a vulnerable situation during the healing process, I think we're more sensitive to that stuff. Maybe a little softer on the pushback and a little bit less ready or expecting to have that happen. You don't have to absorb it. Instead, I found the funniest, different way of dealing with the positivity, to calm down my anxieties, to help me relax, and to give me optimism. I found this person on YouTube. He is a silent hiker. Let me know in the comments if you want a link to his channel. I know it sounds crazy. I'm recommending go watch this person. But if you're going through a time when you just really need something quiet and calming, this guy is a hiker. He's a silent hiker. So he doesn't talk. He just shows you, you sit on his shoulder, basically, on his hikes, and you get to watch. You see snow and trees and forests, wildlife that he just comes upon, setting up his camp, taking the camp apart, drinking his coffee, heading out his walking sticks, the crunching of his boots. I don't know what it was about him. He would look at the top of a mountain. It was like, oh my gosh. And then you'd see him you'd go up with him, and then he'd stand at the top with his arms out, welcoming the sunrise. That's very uplifting. It makes me emotional just thinking about what it meant to me. It made me feel so optimistic. And also just that being at the bottom of a hill and getting to the top, it's the same process. It's just one step at a time. It was very therapeutic. So just let me know if you want to see that. I think that the fact that your spirit has to recover along with your body, you've got to take that in and honor that. And shift number 3, don't try to go back to what you were. Go forward. Stop trying to get back to your old self. I just need to get back into my old body, where the way I was before the surgery. Even saying that sounds ridiculous, but because of course every day you change and grow, and you're growing and evolving. But that version of you that brought you to this point, honor that person, honor her. But the next chapter is about becoming something new. Ask, who am I now? What do I want to become next? What shift changes everything? I realized I wasn't here to return to some former glory. I was here to evolve, and that mindset let me meet the moment with grace, curiosity, and strength. So that's the basics of my story of there and back again. If you're recovering from surgery, a serious illness, or even just life's latest curveball, I see you. I recognize you. Know this, you are not broken. You are becoming. Partner with your body, feed your spirit, and move toward what's next. If you found this helpful, someone who needs to hear this pep talk, stick around because I've got more videos coming out to help guide you to age strong, live well, and build a life that you still deserve. You don't bounce back, you build forward. That's healthy aging.